The rare disease actually killed a Hollywood star to the role of a sleep drug in a high-profile case.
A lot of medical stories to talk about, so here to weigh in on some of the health headlines making news today is Dr. Keri Peterson. Welcome back, a contributor to Women's Health magazine. So we want to start with Harold Ramis.
Yes.
So you hear it was a rare autoimmune disease.
It was called vasculitis. It affects about 200,000 people in this country. What it is an inflammation of the blood vessels. And there are many different types of vasculitis. Some affect the large vessels, some affect the small vessels. It took Harold Ramis about 4 years. Harold, right?
Yeah.
To 4 years to die after he was diagnosed, and we don't know which type he had, but essentially what happens is the blood vessels get inflamed, and any of the organs that rely on the blood supply from that vessel become damaged. They're starved for oxygen. So it could be the kidneys, it could be the brain, it could be the heart, it could be any number of organs that are impacted.
Is it painful?
It can be painful, especially if it affects the nerves. You can get debilitating pain in the legs. It can affect the kidneys to the point where you need to be on dialysis. It can cause stroke.
But is it always fatal, or can it be managed?
Not necessarily. Some cases actually you can recover from completely, and very often they can be well managed with steroids and medications just to keep the antibodies that attack the vessels at bay. Doesn't always lead to death, but in some cases it can.
But so young, 69 years old, and you hate to hear him suffer, a man who brought so much joy to everyone.
I know, he was young.
Is it considered an age that does it come with age, or can it hit anybody at any age?
It can hit children, middle age, and the elderly. It depends on the type of vasculitis. They can affect different groups.
Okay, well, let's talk about this. A rare polio-like disease that's affecting children in California.
This is very, very scary. Apparently, in California, there's about 25 cases of children, the average age of 12, have had a sudden onset of paralysis of their arm or their leg or even both. Doctors, they originally thought maybe it's polio, but the kids were tested negative for polio. They got the polio vaccine. So now the next suspicion is that maybe it's a virus called enterovirus. Polio is in that family of viruses, but we just don't know yet. We only know right now that it's in California, but hopefully with word being spread, other cases that may have been affected in other parts of the country will come forward, and we can sort of analyze the data more thoroughly. But right now we don't know.
You say that it's in California, but is this in a concentrated area? Is it specifically like in certain towns?
It's in certain regions, yes. It's fairly isolated, but it could simply be that physicians that were speaking locally brought it to the attention of each other, and now that it's become public, more physicians will be able to tell about their patients that have
I heard one story where the girl never regained are any of the kids regaining the use of the limbs?
According to what's the research, no, that they're not regaining it, that it's the prognosis is poor. So this is very, very scary. So alarming.
Absolutely.
Well, now here's something people can manage and turn around. It's a popular painkiller, a warning for pregnant women that they shouldn't be taking it. What is it?
It's acetaminophen.
What? It's my favorite.
And it's always been
normally say
I know
that you can take it when you're pregnant. I know that I got the advice from my doctor when I was having headaches.
I know. Physicians often recommend it to pregnant women. If you have a headache, don't worry about it. Well, a study was done. It was done out of UCLA. It looked at 64,000 pregnant women and their children over 17 years, and it found that these women's children had a higher likelihood of developing ADD, attention deficit disorder, if they used acetaminophen for extended periods of time into their second and third trimester.
Right, but in the first trimester, it was less of a chance. Is that correct?
That's correct.
Yes.
So the longer they used it into the second and third trimester, the greater the likelihood their child was diagnosed with ADD. I can count on one hand how many times I took it. I know.
Yes, absolutely. Well, now let's talk about this. The importance of sleep for women. Please tell me why I need more sleep, as if I don't already know.
So women have a harder time recovering from a bad night's sleep than men. So if you go out on a hard night with your husband, you wake up in the morning and he's not complaining and you're like, oh, get me coffee, we have an excuse.
Yes,
and it's hormones. So men make testosterone when they sleep, and when they wake up, that testosterone's present. It has anti-inflammatory effects. It suppresses stress hormones so they can recover better from a poor night's sleep. Women, on the other hand, have been found to have higher rates of stress, anxiety, depression, and even diabetes and heart disease attributed to inflammation from a poor night's sleep. They measured a blood marker called CRP, C-reactive protein. It was higher in women when they had a poor night's sleep In particular, if they couldn't fall asleep within 30 minutes, that caused the highest levels of this stress hormone marker.
Well, I guess I'm okay because I just pass out when I go home.
Lucky you. Lucky you.
Exactly.
Let the guys go out. Just let the men stay out all night. To heck with them.
Night out. Exactly.
Right.
No, I'm hitting the hay early.
Exactly. Well, thank you so much, Dr. Keri
Thank you.
Peterson. We appreciate you being here. Contributor to Women's Health magazine.
Good stuff. All right, still.